Hi, my name is Daniel and I'm a human biology student at the University of California, Santa Cruz and a student health worker here at the Student Health Center. Today we're going to talk about 3 options for selecting your insurance plan while you're a student here at UCSC. The 3 options are UC SHIP, private insurance, and private insurance with cruise care.
And my name's Beth Hyde. I'm a nurse practitioner and I'm going to help you to understand these choices.
So Beth, what is the UC health insurance requirement?
The University of California regents have mandated or required that all registered students have health insurance. The regents also require us to purchase and offer every student a health insurance plan. We call the plan that we use the University of California Student Health Insurance Plan, or UC SHIP. This plan meets the regents' health insurance requirements. However, any registered student who has a health insurance plan that meets the UC requirements can keep their health insurance plan. We've enrolled everyone in our UC SHIP to meet this UC regent requirement. But if you provide documentation and submit it to us to show us that your private plan is sufficient, you can waive or opt out of our plan. We're going to spend the next few minutes talking about how to make that decision.
Beth, what are the advantages of choosing UC SHIP?
Well, as you try to decide about whether or not you're going to take the UC SHIP, you're going to start by comparing the core components of an insurance plan. I'm going to list them now, but I'm going to refer to a video on our website that goes into more detail to define these terms. Health insurance terms that you need to know and to compare are the premium, or the monthly payment, the deductible, or the money you need to pay before the insurance kicks in, your co-insurance, which is the portion of the bill you shoulder versus what the insurance pays for, and your co-pays, or the amount of money you'll be asked to pay towards costs. You're going to want to compare these benefits of a health insurance plan for the UC SHIP and your private plan. You're going to find that UC SHIP is a very competitive plan with a low deductible and excellent co-pay, co-insurance, and premium. For some of you, the UC SHIP will be included in your financial aid package. And for some of you, you're just going to discover that this plan is less expensive than the plan you currently have. The Student Health Center is not a contracted provider with any other health insurance plan. So even though we purchase UC SHIP from the Anthem plans, your Anthem insurance is not accepted at the Student Health Center. This may be a consideration for some of you. For some of you, you need to be able to find a local provider, and you may or may not be able to do that with your private plan. And for some of you, the out-of-pocket maximum coverage on your private plan will not be acceptable to the UC health insurance requirements.
Now, how do I meet the requirements for waiving UC SHIP?
You can meet the requirements for health insurance by either accepting our UC SHIP plan, which is designed to meet the health insurance requirements, or showing us that your plan meets these requirements.
How do I choose which health insurance I should take?
In order to choose the plan, you're going to have to compare the benefits on your plan with the UC Regent health insurance requirements. For some of you, our plan will be less expensive than the plan you're currently using. Some of you will find that there is no local provider here that takes the insurance you currently have, and therefore you will find the UC SHIP a more appropriate plan.
Why should I choose UC SHIP?
Well, our UC SHIP plan is comprehensive, it's convenient, it provides care here on campus. We have expertise in the care of young adults. We provide full medical, counseling, pharmacy, vision, dental coverage, no-cost contraception, access to care worldwide and year-round, access to care after our student health center is closed, access to a broad range of specialty care if needed.
Now, Beth, can I visit the Student Health Center if I waive UC SHIP?
For a student who did not take our UC SHIP, they can use the Student Health Center. Any registered student can use the Student Health Center. However, the fees generated for those visits will vary depending on whether the person has the UC SHIP or took a private insurance plan.
Now, can you give me an example of how costs might vary depending on the plan I select?
Yes, I'd like to talk about the various costs, and I'd also like to talk to you about something called Cruise Care. Cruise Care gives people who kept their private insurance access to services here on campus. So let's use a visit for a sore throat as an example. So the first patient that comes to see us with a sore throat happens to have our UC SHIP insurance. With the UC SHIP insurance, we're their primary care provider. And as their primary care provider, the visit has no fees for the visit. Now, when they come to see me with that sore throat, I'm likely to do a throat culture, or maybe even a blood test or a mono spot. Those fees will be covered under their insurance plan, and therefore they will have no out-of-pocket expense if the tests are done here in the building. When I prescribe an antibiotic for that sore throat, they can take that prescription across the walkway to our pharmacy where they'll have a $5 copay for a generic prescription. The next student comes in. This is a registered student, but they have private insurance. Any registered student can be seen here, and the visit starts with our triage nurses. The triage nurses are going to sit with that patient and make a decision about the best plan of care. That might be some advice on how to take care of yourself, and off the student goes with no fees generated. It might be that the triage nurse and the student decide to use the private insurance, and the nurse might help the patient to identify the local provider where they can use their insurance benefit. Some students will decide that despite having private insurance, they wish to be seen here at the Student Health Center, and they'll be put through for a clinician visit. That clinician visit will generate a fee. That fee is typically around $230. The tests that we order will be fee for service. Those fees will appear on the student's account. If I order a prescription, the student has two choices. They can go to our pharmacy here where they'll pay for the prescription, or they can take that prescription and go downtown to a private pharmacy and see whether or not their insurance benefit covers that prescription. Some insurance companies will not honor a prescription written by a provider not contracted to that insurance plan. The third option for students is our Cruise Care. Cruise Care access gives the student unlimited visits in the health center for illness, acute illness, and injury. Cruise Care is only available to students who have private insurance, did not take our UC SHIP, but chose to have access to services here. Under the Cruise Care, the student can be seen unlimited visits for acute illness and injury, so their sore throat visit does not generate a fee. Any tests we can do on machines in our building, labs or x-rays, generate no fees. However, if I have to send that throat culture out to a private lab to be tended over the weekend, that'll generate a fee for the student, and that fee will appear on their student account. If I write a prescription for a student who took Cruise Care, they're going to pay out of pocket for that medication, or they could take the prescription to a private pharmacy and see whether their insurance will cover the cost using the prescription we provided. 3 sore throat visits, 3 very different fees generated. The UC SHIP, very few costs. The no SHIP patient, the patient who kept their private health insurance, substantive cost. The Cruise Care patient who chose the access Cruise Care, the fees are much more reasonable.
Is there anything else I should know about healthcare at UCSC?
Well, I guess the thing I would want you to know is that the mission of the health center is to keep you healthy so you can succeed academically. That's our job, and we take it seriously. So please don't hesitate to visit us if you've got a problem. And for some of you, you're coming to campus with complex health problems. Make plans in advance. Don't hesitate to contact us if you're coming to campus with a serious health situation and you want to make a transition plan.
Thank you for your help, Beth. If you have any further questions, visit the Student Health Center website. Our next video will discuss the steps for waiving UC SHIP.